Good morning. Today we'll be dealing with a new topic in orthodontics, that is genetics in orthodontics. Coming to the introduction, genetics is that branch of biological sciences which deals with the transmission of characters from parents to offspring. It is a science concerned with structure and function of all genes in different organisms. The term genetics was coined by Bateson in 1906. Many of the basic principles of human genetics were proposed by Joseph Adams in the year 1814. So, the history of genetics dates back to 1814, where Joseph Adams has given many basic principles of human genetics. And it was Gregor John Mendel, an Austrian monk, is regarded as the father of modern genetics. He proposed the famous Mendelian law of inheritance. Now, coming to the molecular basis, so it comprises of cell, chromosome, DNA, and gene. Now, what are the functions of genes? So, genes maintain the specificity of an individual. Genes play a vital role in transmission of characters from parents to offsprings. Genes are very important for synthesis of various protein and enzymes of the cell. Now, coming to the field of orthodontics, these genes plays a major role in the transmission of characters as well as even malocclusion. In the sense, if somebody is having a malocclusion, there is high chance like your skeletal class 2 or skeletal class 3, where it will get transferred to the offsprings. Now, what are mutations? This term is used to denote a change in gene which alters the effect on the character or trait influenced by it. The first mutation was recognized by T.H. Morgan in Drosophila in the year 1910. Now, the question arises why T.H. Morgan has taken Drosophila. It's been shown that this Drosophila melanogaster has almost same genetic pattern or chromosomal makeup similar to human beings. The arrangement of genes in chromosomes was unveiled by Thomas and Morgan et al. In the year 1935 and were awarded the Nobel Prize for the same work. Now, coming to the classification, mutations can be classified in different ways. On the basis of genes involved, point mutation, gross or chromosomal mutation, or on the basis of origin, natural or induced. Now, what are point mutations? So, these mutations involve single gene. Gross or chromosomal mutations are nothing but which is going to involve a chromosome or a set of chromosomes. The best example is polyploidy. Now, on the basis of origin, natural means these mutations arises spontaneously from natural causes, and induced means result of a man-made agents. Now, there are another types like deletion mutation and rearrangement mutations. So, what are deletion mutations? These mutations involve change in the nucleotide content of the gene. Rearrangement includes these type of mutation involves changes of a gene within a genome. On the basis of cell type, somatic not transmitted to offsprings, germinal transmitted in subsequent generations. On the basis of direction, forward and reverse. So forward can lead to wild type to an abnormal phenotype, where reverse means a mutant type to wild type. Now, what is classical inheritance? So classic inheritance pattern described by Gregor Mendel include autosomal dominant, autosomal recessive, and X-linked autosomal. So example of single gene disorders that follows the classic inheritance is Royal Habsburg jaw, where the lower jaw is prognatic, giving rise to class 3 malocclusion. Now, what is polygenic inheritance? So, characters such as height, weight, or intelligence do not follow a simple Mendelian patterns of inheritance. Such characters may controlled by several genes located at different loci having similar effects. So, this kind of inheritance is referred to as polygenic inheritance. For example, class 2 and class 3 malocclusions have a polygenic mode of inheritance. That is, they are influenced by the action of many genes. Now, what is multifactorial inheritance? So, certain conditions not only follow the polygenic inheritance but are also influenced by environment. This type of inheritance is known as multifactorial inheritance. Examples of such conditions are peptic ulcer, essential hypertension, and diabetes mellitus. Now, what is sex linked inheritance? So this inheritance takes place through sex chromosomes. So most of the sex-linked diseases are associated with X chromosome, almost all of which are recessive. Typical examples are hemophilia and night blindness. Now, this is a slide which is showing the mode of inheritance, comprises autosomal dominant and autosomal recessive, including the diseases and features. So, autosomal dominant diseases would be dentigenesis imperfecta, dentin dysplasia, amelogenesis imperfecta, Darius disease, white sponge nevus, to name few. Autosomal recessive includes ectodermal anhydrotic dysplasia and gingival fibromatosis. Sex-linked recessive includes ectodermal anhydrotic dysplasia again. X-linked dominant includes vitamin D resistant rickets. Now come to the mode of transmission of malocclusion. So it comprises of repetitive traits, discontinuous traits, variable traits. So the same trait is seen generation after generation, but not continuously in all the generation. That is your repetitive traits. Discontinuous traits, the trait is seen in family, but not in all generations. It occurs randomly only in certain generations. Variable traits, the occurrence of different but related type of malocclusion within several generations of the same family. Now, genetics in an orthodontic context. So, some of the malocclusions which are considered to have a hereditary influence are cleft lip and palate, Down syndrome, cleidocranial dysplasia, mandibulofacial dysostosis, prognathism and retrognatism, micrognathia and macrognathia, arch shape, size, width, teeth size and shape discrepancies, high arch palate associated with extremely narrow face and head. Now, coming to the very important topic, that is Butler's field theory. So, what is Butler's field theory? It's based on the embryonic field theory of Huxley and Beer, which was proposed in the year 1934. According to this theory, the morphogenetic substances are present in presumptive locations in the embryo, which is responsible for formation of different organs. Butler, in the year 1939, introduced this theory of embryonic fields to odontogenesis. Dahlberg applied Butler's theory to human dentition. He divided the human dentition into four morphogenetic fields comprising of molar field, premolar field, canine field, and incisor field. According to this theory, among the fields, variability is maximum in distal direction and least in mesial direction. So, maximum variation is seen in the molar field compared to the incisor field. Maximum variability will be seen for the third molars in the molar field when compared to the first molars. Now, come to the next important topic regarding genetics, that is the twin studies. So, what is tuning? Human twins can be of two types depending on the time of division of fertilized egg, that is, monozygotic twins or identical twins, dizygotic twins or non identical twins. Now, what are monozygotic twins? These they are two individuals developed from a single fertilized ovum which divides into two at an early stage of development. Monozygotic twins thus have a genetic makeup identical to each other. Monozygotic twins will always be of same sex. Theoretically, they should have same phenotype because they have identical genotype or genetic constitution. Now, what are dizygotic twins? They are two individuals developed from separate ova. The two ova are fertilized by two different sperms at the same time. Their genetic makeup is not identical as they develop from two different embryos. They may be of different sexes. Non-identical twins are analogous to normal siblings except that they have same intrauterine life. Now, what are the basic concepts of these twin studies? So, twin studies represent a special class of family aggregation studies which disease occurrence is investigated in pairs of monozygotic and dizygotic twins. If factors play a role in the causation of a disease, it will affect both members of the pair more frequently in monozygotic than in dizygotic twins. So, what they are telling is that monozygotic twins will be showing more genetic play than the dizygotic twins. Now, there are two terms which we have to be familiar with, that is concordant and discordant. So, if twins have identical features in the respect of a trait or a character, then they are said to be concordant. Now, if the twins have dissimilar features in respect of trait or character, then they are said to be discordant. Now, this is the diagram depicting the concordant, discordant, and the twin studies. In a case of monozygotic twins, they have similar genetic makeup. That means if genetic influences are strong, they should be concordant for that trait postnatally. However, if a trait is discordant in monozygotic twins, that means expressing dissimilar features, it shows the dominance of environmental influences on this genetic expression postnatally. This is because they have different environmental background postnatally. See, the diagram also shows that where they have shown that with same DNA and different environment, if the features are same, it must be due to genetics. If the features are different, then it must be due to environment. Now, coming to the dizygotic teens, in that case of dizygotic teens, they have a similar environmental condition. Hence, the influence of genetic as well as the environmental factors in the expression and development of an individual can be studied. Same like the previous diagram where they have shown a dizygotic teens with a different DNA and same environment. If the features are same, it must be due to environment. If the features are different, it must be due to genetics. Now, what is the conclusions of teen studies? So, teen studies have revealed the following: genetic factors have a more important influence than non-genetic ones. Genetic variation has a major effect on arch width and length. Greater genetic basis for tooth size and shape. Crown dimensions were largely under genetic control. Thus, the twin studies provide a means of understanding genetic contribution in the growth and development of an individual. So, twin studies also showed that identical twins were not occlusally identical, indicating the environmental influences as well. Now, that finishes the part and parcel about genetics in orthodontics. Thank you.